I have been sitting on this story for 3 years. 3 years of replaying conversations in my head, of waking up at 2 in the morning with my heart hammering against my ribs like it's trying to escape, of standing at the kitchen window watching the sun rise over the backyard my wife, Margaret, planted with her own hands, and asking myself whether I did the right thing, whether I should have done it differently, whether any of it mattered in the end, or whether the end was always going to look exactly the way it does now, me, at this kitchen table, with cold coffee and this particular quality of morning light, trying to put words to something that doesn't quite have words. I'm 79 years old. I'll be 80 in October if everything holds, which the doctors say it will. I've lived long enough to know that some stories don't have clean endings. Some stories just have the truth, and you carry it, and it changes you, and that's all there is. But I also know that when you carry something this heavy for this long, it starts to press down on your bones in ways that keep you up at night, and eventually you have to set it down somewhere. Every man I've known who lived into his late 70s has had his version of this. The thing he carried too long before he put it down. The thing he should have said earlier. The story that needed to be told out loud before it could stop needing to be told. So I'm setting it down here. I don't know who will read this, and in some ways it doesn't matter. What matters is that I say it out loud, or as close to out loud as written words can get, because the alternative is taking it with me, and I don't want to take it with me. Margaret is already gone. The least I can do is arrive wherever I'm going without this particular weight. My name is Kevin James. I was born in October of 1945 in a small town in rural Ohio, the second of 4 children, in a house that smelled like wood smoke and baked bread, and the particular kind of clean that comes from living simply and not having enough money to clutter your life with things you don't need. My father was Arthur James, and he worked at the mill for 31 years, from the time he was 19 until the mill closed, and he had to find work elsewhere, which he did, without complaint, driving 40 minutes each way to a factory job that paid less but was work, which was the only standard he applied. My mother was Dorothy James, née Crawford, and she raised the 4 of us and kept the house and grew vegetables in the summer and put them up in jars in the fall and made everything stretch in ways I didn't appreciate until I was an adult trying to do something similar and discovering how hard it actually was. We were not poor in the grinding, desperate sense of the word. We were what my father called comfortable, which meant we had enough, and we knew it, and we knew the difference between enough and more than enough, and we did not confuse wanting more with needing it. This distinction between what you have and what you want, between what you need and what you've convinced yourself you need, is one of the most important things my parents taught me, and one that I spent 40 years trying, with uneven success, to pass on to my own children. I married Margaret Louise Whitfield in June of 1969 at a church in Dayton where her family had worshipped for 3 generations. She was 23 and I was 23, and we were both too young to know what we were getting into, which is probably the only way anyone gets into a marriage that lasts. I had met her at a church social 2 years earlier, and the way I remember it, which Margaret always disputed, was that I saw her across the room and thought, that's the one. She said I was romanticizing it. She said I spent the first 40 minutes of our acquaintance trying to impress her with a story about a fishing trip that had no particular point, and that what she remembered thinking was not here is the man I'll marry, but rather he seems harmless enough. We argued affectionately about this for 47 years. We had 47 years together before she died. 47 years of morning coffee and grocery lists and arguments about money and the thermostat, and what to do about Marcus, and what to do about Patricia, and whether the gutters needed replacing, and whether I was working too much, and whether she was being too protective of the kids, and all the 10,000 small disagreements and reconciliations that make up a life. And underneath all of that, the particular kind of quiet that fills a house when 2 people have been in it together long enough that they don't need to fill every silence with words. The silence of people who know each other so well they've run out of surprises and found that a life without surprises is not boring, but comfortable in the truest and deepest sense of the word. She died in March of 2019, on a Tuesday, with snow coming down outside the hospital window and me holding her hand and our two children in chairs on the other side of the bed. She was 72 years old, and she had fought the cancer for 2 years, fought it the way she fought everything, quietly, stubbornly, without complaint, without asking for sympathy, and with a kind of dignity that made everyone around her feel like maybe they could stand to be a little better than they were. The nurses talked about her in the hallways. The doctors were kind to her in the particular way that doctors are kind to patients they admire. I held her hand and I told her things I should have said sooner, things I'd been saving for some indefinite future that had suddenly arrived, and she squeezed my hand and said, "Kevin, I know," and that was the last thing she said, and it was enough because she was right. She did know. She had always known. After she died, I drove home to the house alone because Marcus and Patricia had offered to follow me and I'd said no. I wanted to drive myself, and I did. I drove through the grey March afternoon and I parked in the driveway and I sat in the car for a long time, maybe 15 minutes, maybe longer. The snow had stopped while we were at the hospital and the sky was that particular pale color it gets after snow, a color that has no good name in English, and the house looked the way it always looks. Brick and white trim, the oak tree in the side yard going dormant, the front walk that I'd shoveled that morning because I'd needed something to do with my hands. I went inside. I sat in her chair in the living room, the one by the window where she used to read in the afternoon, the worn blue velvet chair that we'd gotten second-hand when the kids were small and that we'd talked about replacing for 20 years and never quite had. I sat in it and I could smell her, faintly, her soap, and something else that was just Margaret, some particular chemistry of skin and hair and presence that I couldn't name, but that I had known for 47 years, and that I already, sitting in that chair at 3 o'clock on a Tuesday afternoon with the pale sky outside the window, understood I would spend the rest of my life trying not to forget. I understood for the first time in my life what it means to be utterly alone. I want to tell you that my children were comfort to me in those early days. I want to tell you that they stepped up the way you hope your children will step up when the worst things happen, when the parent they have been leaning on for their entire lives is no longer there to lean on and they have to figure out how to hold each other up. And in some ways, they did. They came to the funeral and helped with the arrangements and made sure I was eating. Marcus, who was 44 at the time and lived about 2 hours north in a suburb of Cleveland, came and stayed for a week. He slept in the guest room and made breakfast in the mornings and sat with me in the evenings, and if his presence sometimes felt like a weight rather than a comfort, if his way of processing grief was a relentless practical energy that occasionally made me feel like we were solving a logistics problem rather than mourning his mother, well, he was there, and being there counts for something. Patricia, who was 41 and lived across town, came over every 2 or 3 days in those first weeks. She sat with me and looked at photographs and cried with me, which was different from Marcus's way. Patricia's way was more like her mother's, more willing to just be in the grief without immediately trying to organize it away. She brought food and checked on the garden, and on 2 occasions spent the night, because I think she could see that the evenings were bad for me, that the particular silence of the house after dark had a quality that I wasn't prepared for. But grief does something to people that kindness and logistics and good intentions can't fully address. It shows you things about them that the ordinary business of living keeps covered over. And what grief showed me about my children, what I began to see in those first weeks and months after Margaret died, was something I had been carefully not looking at for years, the way you carefully don't look at a crack in a wall, because if you look at it, you have to do something about it. They had always been competitive with each other. That was not new. Marcus was the older one, the driven one, the one who had put himself through law school and built a career in corporate litigation that had made him, by any external measure, quite comfortable. He had a house in a good suburb, a wife named Sandra who was a pediatric dentist, 3 kids who went to good schools. He wore good suits. He drove good cars. He held himself with the particular confidence of a man for whom success had been consistent enough to seem like a natural state of affairs. Patricia had taken a different path. She'd gotten a degree in education, married a man named Don who worked in insurance, had 2 kids, and built a life that was solid and good and full of real things, but not, By the standards Marcus used to measure things, impressive. She taught third grade for 15 years before switching to a district coordinator role that she found more meaningful even though it paid a bit less. She drove a sensible car, and her house was in a sensible neighborhood, and her children did ordinary activities, and she was, as far as I could tell, genuinely happy in a way that didn't require external validation. You could feel the tension between them at holidays and family gatherings, the way you feel tension in a room where the air pressure isn't quite right. The way Marcus talked about his work with an enthusiasm that always had an edge of "look what I've made of myself" underneath it, directed not at the table generally, but at Patricia specifically, as though everything he said needed to be measured against her and found superior. The way Patricia got quiet when he did it, the way she looked at her plate, or out the window, or suddenly needed to help clear the table. Margaret had always managed that tension. She had a gift for it, a natural social intelligence that I've never had and that I think both children inherited unevenly. She had a way of smoothing things over and redirecting conversations and making everyone feel seen and valued that was so natural and so seamless that you didn't notice she was doing it until she was gone and no one was doing it anymore, and suddenly holiday dinners had a slightly raw quality, a slightly exposed feeling, like a wound without a bandage. About 2 months after she died, Marcus drove down one Saturday and Patricia came over, and the three of us had dinner together at the house. It was the first time all three of us had been together since the funeral, and I had thought it was going to be one kind of thing, a gathering of the people who had loved Margaret most, sitting around her table, eating her food or something like it, talking about her and missing her together, and for the first hour or so it was that. We looked at photographs. We told stories. Patricia cried. Even Marcus, at one point, had to leave the table for a few minutes, and when he came back his eyes were red, and he poured more wine without saying anything, and I loved him in that moment with a ferocity that surprised me, because what I was seeing was the grief underneath the competence, the child underneath the lawyer. But then, over dessert, the conversation shifted. It started with Marcus saying something about the house. He had his hands wrapped around his coffee cup. He'd switched to coffee after the wine, and he was looking at me with that expression he gets, the one I have known since he was about 12 years old, the one that means he has already decided something and is now in the process of explaining to you why his decision is the correct one, is in fact the only reasonable conclusion any rational person could reach. So your job in this interaction is simply to arrive at the same conclusion by the end of the conversation. "Dad, I've been thinking," he said, "this house is a lot for you to manage on your own. 4 bedrooms, that big yard. It's really a lot for one person." "I've managed it for 40 years, I said. "You managed it with Mom, that's different. I can hire help if I need it. But the upkeep, and the market is really strong right now, has been for a couple of years. If you were thinking about downsizing at all, this would be an excellent time to." "Marcus," I said, "I just buried your mother 8 weeks ago. I am not making any decisions about anything right now." He raised his hands in a gesture that was meant to communicate that he was backing off, that he was only raising the possibility that of course I was right, and of course there was no rush. And then he nodded and said, "Of course, Dad, of course, just something to think about when you're ready." Patricia was looking at her plate. I noticed that she did not say anything. I let it go, but I noticed that Marcus had raised it and that he'd had the data ready. The market is strong, it's an excellent time, which meant he'd been thinking about it before he arrived. And I filed that away in the part of my mind where I file things I'm not yet sure what to do with. That dinner was the beginning of something I didn't fully understand at the time. Looking back now, with the clarity that comes from sitting at a table 3 years later and being able to see the whole picture laid out in front of me, I think I understood it better than I admitted to myself. But there are things you don't want to know, and so you find ways of not quite knowing them. You take the evidence, and you find the most generous explanation for it, and you hold on to that explanation with both hands because the alternative explanation, the one that's sitting right there, obvious, waiting to be named, is the one you can't afford to look at yet. The most generous explanation was that Marcus was processing his grief through practical concerns. That is a real thing. Lawyers especially tend to manage anxiety and pain through logistics, through problem solving, through the creation of frameworks that give chaos some shape. I told myself that's what this was. I told myself Marcus was scared of losing me too and was trying to prepare, to plan, to make sure things were in order. I told myself his mother would have understood. And I kept telling myself that for the next several months, even as the evidence accumulated, that something else was going on. In the months after Margaret died, things started happening that I noticed but didn't quite put together, the way you notice individual threads without seeing the pattern they're making. Little things, individually explicable. The way Marcus started asking more detailed questions about my finances during his visits, which accounts I had, what the approximate balances were, whether I'd updated my beneficiary designations since Margaret died, whether I had a financial advisor, and if not, whether I'd thought about getting one. I told myself this was practical concern. He was an attorney. Attorneys think about these things, especially when they've just watched their second parent age into the phase of life where these things become urgent. The way Patricia started offering to help me with paperwork and bills, which was kind of her, and which I let her do because I was grieving and tired and genuinely grateful that someone was paying attention. She came to the house once a week for a couple of months, and we would sit at the kitchen table and go through whatever had accumulated, bills, insurance statements, the pile of papers that grows up when you've been focused on other things. And she would help me organize and respond to things, and I would make coffee and feel slightly less alone for a few hours. What I noticed only later was that Patricia, during these sessions, had access to a fairly comprehensive picture of my financial situation. She knew which accounts existed, approximately what was in them, what income I had, what regular expenses there were. She had helped me reorganize my files, which meant she'd gone through Margaret's files too, looking for anything we might have missed. She was doing all of this in good faith, I believe, or at least in the faith that she was doing something helpful. But she was also, without necessarily intending to, creating a situation where my financial life was less private than it had been. I don't blame Patricia for this. I want to be clear about that. She was trying to help. She has always tried to help. But help and transparency are not the same thing, and sometimes help has consequences that the helper doesn't intend and the helped doesn't notice until later. About 6 months after Margaret died, I had a health scare. I'd been having some discomfort in my left arm for several weeks, not pain exactly, more like an ache that came and went, and some shortness of breath when I climbed stairs or walked quickly. I'd been ignoring it the way old men ignore things because they don't want to be a bother, because they've been managing minor complaints for decades and have gotten into the habit of distinguishing between the things that matter and the things that don't matter by waiting to see which ones go away. This one didn't go away. At my regular checkup with my primary care doctor, a man named Dr. Forsberg, who has been my doctor for 15 years and who has the comfortable familiarity of someone who has seen you at your worst and still returns your calls, I mentioned the symptoms. He listened carefully and then ordered an EKG and some blood work, and the results were unusual enough that he referred me to a cardiologist. He was calm about it. Dr. Forsberg is always calm, which is one of the things I value about him, but he was direct. He said he'd seen something in the EKG that he wanted a specialist to look at, and that I should get an appointment sooner rather than later. The cardiologist he referred me to was Dr. Amara Mehta, a woman in her early 40s who had an office at the regional hospital and a manner that I appreciated immediately, precise, direct, without the false warmth that some doctors deploy like a social lubricant. She asked good questions and listened to the answers and spent real time with the tests. After 2 appointments and some additional imaging, she told me what she'd found. There was some narrowing of a coronary artery, not severe, but worth monitoring carefully. She wanted to see me back in 3 months, wanted me to make some specific changes to my diet and add a supervised walking program, and had prescribed a medication to help with the arterial health. She did not say anything about surgery. She was specific about this because I asked. She said she did not believe intervention was indicated at this stage. She said that in her clinical judgment, the conservative management approach, monitoring, lifestyle changes, medication, was the appropriate path for my situation. She said this clearly and without hedging. I told Marcus and Patricia about the diagnosis at a family dinner a few days later. I told them the facts as Dr. Mehta had explained them: coronary narrowing, monitoring, lifestyle modifications, no surgery recommended. I told them because I believed in keeping my family informed. I believed in transparency, in not hiding difficult things. I thought, doing the responsible thing. This was my mistake, though I didn't see it as a mistake at the time. I thought I was being responsible. I thought I was giving my children information they needed and deserved. I did not think I was handing one of them a roadmap. Marcus called Dr. Mehta's office the next day. I found this out not immediately, but about 6 weeks later, when I went to my follow-up appointment and Dr. Mehta mentioned it. She told me that someone identifying himself as my son and my attorney had called and asked to speak with her about my prognosis. She'd spoken with him briefly before her intake coordinator had jumped in and clarified that she couldn't discuss patient medical information with non-authorized parties, at which point the call had ended. He identified himself as my attorney, I said. That's what my notes say. She looked at me steadily. Mr. James, I want to be direct with you. I don't know what your son's concerns are, but I want you to know that your condition is being managed appropriately and there is no reason for urgency. If you feel there's pressure from family members that's affecting your comfort with your treatment plan, that's something we should talk about. I told her I appreciated her telling me and that I would handle it. She nodded in a way that suggested she had seen situations like this before and was reserving judgment. I didn't confront Marcus about the call. I filed it, another thread. Over the following months, I had more follow-up appointments with Dr. Mehta, and the news continued to be encouraging. The lifestyle changes were helping. I had gotten serious about the walking program, doing 40 minutes every morning regardless of weather, and I had overhauled my diet in ways that my body responded well to. My numbers were improving. The narrowing wasn't getting worse. Dr. Mehta was pleased with my progress and said so. And then Marcus started talking about getting a second opinion. He raised it at a dinner at his house in November, about 9 months after Margaret had died. Sandra was there. She's a quiet woman who tends to listen more than she talks, which I've always respected, and the conversation had been pleasant, and then over coffee Marcus brought it up. Dad, I've been doing some reading on your condition, coronary artery disease, and I think you should consider getting a second opinion on the treatment approach. Dr. Mehta is a very good cardiologist, I said. I'm sure she is, but she's conservative. There are more aggressive treatment options, interventional approaches that have shown real results in improving outcomes for patients with your profile. I think you deserve to hear all of your options. She's told me my options. Conservative management is the appropriate approach for my situation. That's her opinion. Other cardiologists might have a different view. Sandra quietly got up and started clearing dessert plates. She had a way of absent herself from conversations that were becoming difficult, not in a cowardly way, but in the way of someone who recognized that her presence was not what was needed and that her absence was a gift she could offer. Marcus, I said, I'm not looking for a second opinion. I'm satisfied with Dr. Mehta's assessment. I just want to make sure you're getting the best care, Dad. I appreciate that. I am getting good care. He didn't push it that night, but he'd planted something, and the thing about Marcus was that when he planted something, he let it grow before he came back to it. He had learned this skill somewhere, law school maybe, or from his own particular temperament, and he used it naturally, the way some people use charm or humor. He said a thing once, let it sit in the room, and came back to it weeks later as though it had been agging into something. About 2 weeks after that dinner, he called to tell me he had made an appointment for me with a cardiologist named Dr. Randall Opper at the University Medical Center in Cleveland. He had done this without asking me. He told me it was just a consultation, just to hear a different perspective, and that he'd already cleared his schedule to drive me there himself. He spoke as though the thing were already happening, as though my agreement were a formality. I went because saying no would have required a confrontation I didn't yet have the clarity for, and because I kept telling myself the most generous interpretation. Marcus is scared of losing me. He needs to do something. This is how he does something. Let him do this. Dr. Randall Opper was a different kind of doctor from Dr. Mater. His office was in the newer wing of the hospital, all glass and polished surfaces and natural light, and the walls held photographs with governors and athletes and a framed magazine cover with an article about innovations in cardiac medicine. He was tall and silver-haired and moved through the examination room with the confidence of a man for whom certainty is a professional tool, the way a hammer is a tool, something you pick up and use without giving it much thought. He reviewed my records and examined me and spent about 20 minutes with me. It felt brisk, by comparison to Dr. Mater's appointments, which were thorough enough that you came away feeling examined. And then he told me that in his opinion, I was an excellent candidate for a coronary stenting procedure that could significantly reduce my risk of a cardiac event. He said this with the tone of someone announcing a solution, not a possibility. My cardiologist in Columbus doesn't think I need that procedure, I said. There are different schools of thought, he said, in the tone of a man who knew which school was correct. The conservative approach monitors and manages. The proactive approach involves intervention. Given your age, your symptom history, and your imaging results, I think proactive intervention is clearly indicated. You've been symptomatic. You have a quality of life issue as well as a risk reduction issue. He mentioned anesthesia risk briefly, in the way you mentioned something unpleasant without dwelling on it, a footnote to the main argument. I said I'd think about it. He said his office would send paperwork. On the drive home, Marcus was quiet in the way that I mentioned, unusually quiet. The kind of quiet that means thinking is happening at a high volume. I watched the interstate and thought about Dr. Opper and his magazine cover and his confidence, and the way he'd spoken about Dr. Mater's approach as though it were a position held by lesser intellects. I thought about the difference between certainty and knowledge, which is something Margaret used to talk about. She had taught school for several years before the kids were born and then again afterward, and she always said that the students who scared her most were the ones who were too certain too quickly. That certainty that came easily was usually the wrong kind. 3 days later, Marcus came to the house with a folder. The folder was organized. It had tabs. There were sticky notes on certain pages indicating where I needed to sign. He set it on the kitchen table and said, "Dad, I've talked to Dr. Opper's office and they have an opening next month. I think you should do this." Marcus, Dr. Mater. Dr. Mater is wrong. No qualifier, no softening, no I think she might be or there's reason to believe. Just, she is wrong. I've done extensive research on this. The evidence base for stenting in patients with your symptomatic profile is clear. The risk of a cardiac event without intervention is real and meaningful. And the risk of the procedure itself. Manageable, especially with someone of Opper's experience. Dr. Mater specifically mentioned anesthesia risk for someone my age. That's the conservative view. Opper does these procedures routinely on patients much older than you. I looked at my son across the kitchen table and I saw someone who had done his homework, who had built an argument brick by careful brick, who was not going to be moved by pushback. I also saw the grief underneath the argument, the fear underneath the competence, the look of a man who had lost his mother and could not stand the idea of losing his father and was channeling that terror into action the way he channeled everything into action. "Let me talk to Dr. Mater again," I said. "I want her perspective on Dr. Opper's recommendation before I decide anything." "Of course," he said, and nodded, and poured himself coffee. He was agreeing to my request while also, with the folder sitting between us on the table, implying that the decision was already essentially made and we were just processing the final details. But Dr. Mater was on vacation. Her office told me she would be back in 2 weeks and they could schedule a follow-up then, or she had a colleague covering urgent matters if I felt there was something urgent. There was nothing urgent, I said. I would wait. Over those 2 weeks, The pressure from Marcus intensified in ways that were subtle and effective. He called more often, every other day, sometimes daily, with new pieces of information, new research he'd found, new reasons why the procedure made sense. He dropped by the house twice, both times with food or some practical offering that made it difficult to feel impatient. He talked about the surgery in terms that assumed it was happening, before the procedure, and once you've recovered, and afterward, when you're feeling better. And this grammatical assumption, this way of speaking about a decision as though it were already made, was one of the more sophisticated techniques I've ever encountered, not because Marcus deployed it cynically, but because I think he had genuinely convinced himself that it was already decided. Which made the assumption feel natural and difficult to argue with. Patricia, when I talked to her about all of this, was warm and vague in equal measure. She said things like, "I just want what's best for you, Dad, and you know your own body, and whatever you decide, we'll support you." These were the phrases of someone who was staying out of it, not unkindly, but definitely deliberately. I had the follow-up appointment with Dr. Mehta as soon as she returned. I told her about Dr. Opper's recommendation and showed her his report. She read it carefully, asked me several questions, and then set it down. "Dr. Opper is a good surgeon," she said. "He's very skilled technically." I noticed she'd said technically. "His recommendation is not unreasonable given the information he had," she continued. "But it's also not the only supportable conclusion from your case. The research on elective stenting in stable patients like yourself is genuinely mixed. There are studies that show benefit and studies that show no significant advantage over optimized medical therapy. My professional judgment, looking at your specific situation, your response to the current treatment, your overall health picture, is that you are stable and that intervention carries risks that are not clearly offset by the benefits." "What risks specifically?" I asked. "The standard risks of any interventional cardiology procedure: reaction to sedation or anesthesia, bleeding at the catheter insertion site, risk of infection, small but non-negligible risk of arterial damage, stroke, or cardiac event during the procedure. In patients over 75, anesthesia tolerance is something we always monitor carefully. You're healthy for your age, Mr. James, but the procedural risk is not zero." "Dr. Opper mentioned anesthesia briefly," I said. "He would have mentioned it in terms of being manageable," she said, "which it is in his hands, but I want to be precise about the fact that it is a real risk, not merely a formality." I left that appointment with my head clearer than it had been in weeks, and with a renewed sense that Dr. Mehta's caution was not conservatism for its own sake, but genuine, careful clinical judgment grounded in knowing my specific situation. I told Marcus what Dr. Mehta had said. He was dismissive of her assessment in a way that I found, for the first time, genuinely irritating rather than merely tiresome. He reframed her caution as timidity. He reframed her experience with my case as narrow. He had an answer for every point she'd made, and his answers were articulate and sourced and sounded, if you didn't think too carefully about the fact that he was a lawyer and not a doctor, like expertise. And eventually, not that day, but over the following week, under the accumulated weight of his concern and my own fear about my heart and the tightness in my chest that hadn't quite gone away, I said yes. I agreed to the procedure. Marcus had the paperwork ready within 24 hours. This, looking back, was the clearest signal I had. Not that he'd had the paperwork prepared in advance, though that was a signal, but that he had it ready within a day, which meant he had been keeping it ready, which meant he had been assuming the answer would be yes before I gave it. He brought the folder to the house on a weekday afternoon. He sat down at the kitchen table and opened it with the practiced efficiency of someone who has presented documents before, which of course he had, thousands of times, it was his life's work, and said, "It's pretty standard. Consent forms, insurance authorization, a few other things. I went through it all. I'll walk you through the important parts." "I'd like to read it myself," I said. "Of course," he said. He got up and poured himself a cup of coffee and stood at the counter with his phone, in the posture of a man who has plenty of time and is demonstrating that fact. I sat down and started reading. The type was small, smaller than I'd have chosen for a document this important, and the language was dense medical legal language, the kind that is technically accessible but practically opaque for anyone who hasn't spent years wadding through similar documents. I read carefully, but I was also aware of Marcus's presence in the room, the particular weight of it, the way his being there created a subtle current in the air that made concentration harder. I read through the first pages, general consent to the procedure, description of what would happen, standard liability language, and I was on page 5 or 6 when Marcus said something. He said it casually, something about needing to get back to Cleveland before the traffic got heavy, about Sandra expecting him for dinner, about a call he needed to take at some point in the next hour. He said it the way you say a thing when you want it to be in the room without appearing to insist on it, just information, just context, no pressure of course. I looked up and looked at him. He was looking at his phone. I went back to the papers. I turned a page. I found the section about risks and read through them. I found the section about the surgeon and his qualifications. I turned another page. I wasn't quite sure what I was looking for, but something in the back of my mind was saying keep reading, something isn't accounted for. There were more forms, I said, about the specific procedure. Those are the standard surgical consent forms. I went through them thoroughly. They're basically identical to what you'd see in any cardiac procedure: risks, benefits, alternatives, what to do if something unexpected comes up. The most important things to sign are page 7, which is the insurance authorization, and page 12, which is the main consent. I turned to page 7. The insurance authorization looked standard. I turned to page 12. It was the consent form, and it was dense and several pages long, and I read the first 2 pages of it, and I was tired. I was tired in the way that you're tired when you're almost 78 and grieving, and your left arm aches sometimes, and you've spent the last several months being managed by people who care about you in different ways for different reasons, and you just want it to be over, whatever it is. I signed. Looking back at that moment from where I sit now, I understand something about it that I didn't understand then. I signed not just because I was tired, and not just because Marcus's presence created pressure. I signed because, at some deep level, I had stopped trusting my own judgment. The grief, the health scare, the parade of doctors and opinions, the months of Marcus's steady, confident voice telling me what the right answer was, all of it had worn down the part of me that normally says, hold on, think about this. The part that Margaret used to say was my best quality, the fact that I was slow and careful and not easily pushed into things I hadn't fully considered. She would have hated what I had become in those months. She would have sat across from me and said, Kevin, why are you letting him do this? And I wouldn't have had a good answer. I signed, and the appointment was scheduled for 3 weeks later. Those 3 weeks were strange. I went through my ordinary days with a new layer of awareness underneath them, a low hum of something that wasn't quite dread, but wasn't not dread either. I went for my walks and noticed my breathing more than I usually did, catalogued every twinge and ache in a way that was probably not helpful. I tended the parts of Margaret's garden that I'd been keeping up, the perennial beds, mostly, things that didn't need much intervention, just maintenance, and I talked to her sometimes while I was working in them, which I'd started doing a few months after she died, and which I'd decided wasn't crazy. It was just talking. People talk to the dead. It's one of the things we do. I called Gerald Hutchins. Gerald was my oldest friend. We'd known each other since we were both 22 and working at the hardware store in town, and we'd stayed in contact through marriages and careers and children and retirements and moves, the long thread of a genuine friendship that had never been quite close enough for weekly contact, but was always exactly where you'd left it when you came back to it. Gerald lived in a retirement community in Sarasota now, and had had his own cardiac surgery 5 years before, and we talked maybe 4 or 5 times a year. I called him and told him what was happening. I told him about the diagnosis and the 2 cardiologists and the disagreement between them and Marcus's role in all of it. Gerald listened without interrupting, which was one of his qualities, the patience to hear the whole thing before he said anything. When I finished, there was a pause. This Dr. Opper, he said. Who found him? Who got you the appointment? Marcus did. Another pause. And your regular cardiologist, Dr. Mater, she's not recommending the surgery. Specifically, not recommending it. The sound Gerald makes when he's thinking through something that concerns him. Kevin, I've been through this kind of thing, as you know. Heart procedures they're not nothing, even the less invasive ones. They're real. The anesthesia alone is, at our age, it's a factor. Dr. Mater mentioned that. Opper minimized it. Yeah, the surgeons usually do. A pause. Kevin, let me ask you something directly, and I want you to think before you answer. What does your gut say about all of this? I was quiet for a moment. My gut had been saying something for months. I had been carefully not listening to it. But Gerald was asking, and you don't lie to a man you've known for 57 years, so I gave him the honest answer. My gut says something is off, I said. I don't know exactly what, but something. And you signed papers anyway. I did. Kevin, his voice was gentle, the way it gets when he's about to say something he knows I don't want to hear. If your gut is telling you something is wrong, I think you need to find out what it is before you let someone, even a good surgeon, put you under. I said I'd been trying to figure out how to do that. He said he didn't know how either, but that he'd be thinking about it, and that he'd call me in a few days, and that I should trust myself more than I'd been trusting myself. After I hung up with Gerald, I sat in the kitchen for a long time. The late afternoon light was coming through the window, the particular golden light of October that always makes me think of harvest and endings and the particular beauty of things winding down. I thought about the papers Marcus had given me. I thought about the things I'd signed and the things I hadn't quite read. I thought about the addendum I'd noticed briefly, or thought I'd noticed, at the back of one of the pages, clipped to the back of the previous page so that I'd have missed it in my initial reading. I thought about whether I'd imagined it. I went and got the folder. The folder was on the kitchen counter where I'd left it. I took it to the table and sat down with my good glasses, and I read every page. The procedure consent was what Marcus had described. The insurance authorizations were mostly standard. The surgical disclosure forms were thorough in the way Marcus had indicated. And then in the back of the folder, clipped to the final page of the surgical consent, easy to miss, designed, it seemed to me, to be part of the pile without being obviously part of it, was a single page that I had not, in my initial reading, seen at all. I read it. I read it again. It was titled Healthcare Representative Financial Authorization, and it authorized Marcus James, designated as my healthcare representative, to act on my behalf in all financial matters related to my medical care and treatment, including but not limited to insurance claims and reimbursements, billing disputes, financial settlements related to my medical care, and this was the part I read 3 times. Decisions regarding the management and disposition of assets held in my name in the event that I was temporarily or permanently incapacitated or deceased. The language was broad, deliberately broad. It was the kind of language that, if challenged, a lawyer could argue was limited to medical financial matters. But it was also the kind of language that, in practice, might authorize decisions that went well beyond what I'd have consented to if I'd understood what I was signing. I sat with that page for a long time. Then I called Patricia.